Hello everyone, I'm Xiaohong Liang from Department of Immunology, Shandong University. In this lecture, we are going to talk about tumor antigens. We all know tumor antigen is an initiator to induce anti-tumor immune responses. It can be captured by antigen-presenting cells like dendritic cells, and then is processed and presented to T cells for stimulating the activation of T cells. Simultaneously, tumor antigens could provide novel tumor biomarkers for clinical diagnosis and also could be novel targets for immunotherapy and tumor prevention. Generally, tumor antigens refer to all newly expressed antigens or overexpressed antigens during the generation and development of tumor. As shown in this slide, both newly expressed antigens and overexpressed antigens could be expressed on tumor cells. Based on the expression patterns of tumor antigens, it could be classified into tumor-specific antigen, abbreviated as TSA, and tumor-associated antigens, abbreviated as TAA. Tumor-specific antigens are only expressed on tumor cells, but not on normal cells. Tumor-associated antigens refer to antigens that are also expressed on normal cells, but highly expressed on tumor cells. Next, I'd like to introduce some kinds of common human tumor antigens. Firstly, tumor antigens are encoded by some mutated genes like p53 or RAS. The fusion genes like BCR-ABL fusion gene in chronic myelogenous leukemia and some acute lymphoid leukemia, or EML4-ALK fusion gene in non-small cell lung cancer. These kinds of tumor antigens has the ability to stimulate specific immune response for the corresponding antigen-specific CD8 positive T cells are detected in both patients and in animal models. Virus infection closely correlates with the development of the indicated tumors. Thus, in this situation, virus-encoded proteins are also detected in these tumor cells. For example, HBV viral proteins could be tumor antigens expressed in liver cancer cells. Cancer testis antigens are one type of tumor antigen, which are not expressed on normal material cells except for testes, but highly expressed especially on melanoma cells, such as MAGE-1, MAGE-3, GIG-1, GIG-2, or beige. These antigens are also important potential targets for immunotherapy of human melanoma. Some antigens expressed at very low level in normal tissues are abundant in malignant cells and triggers T cell activation, such as AFP, CEA, HER2, or PSA. Several lines of evidence support new antigens as being crucial targets of anti-tumor T cell responses. Thus, new antigens are optimal targets for personalized tumor-specific cancer vaccines. Then, how to screen the tumor neoantigens with high specificity and high sensitivity is an important issue for targeting tumor therapy. With the development of high throughput techniques to establish tumor cDNA expression library or to screen the new antigen based on tumor-specific antibody in patient sera is the most common strategies for identifying normal tumor antigens.